I don't think of all the reasons why I can't do it. I just think of all the reasons why it would be cool to do. So my view is if something doesn't exist, build it, which is literally what we did. We built it. We've now got 25,000 people in that group. And also I think it's the first time that implementation of a digital health tool, whether it's an AI scribe or agentic AI, has demonstrated benefits immediately. I think it's more about our roles changing rather than being replaced. I think it's about teaching clinicians how to use AI, when's the most appropriate time to use it, and it's governance in a way that we've not done governance before, because we're going to have this continuous monitoring and governance processes of technology that we've never really encountered before. I'm always about connecting different parts of the industry, because I think we live too much in our own little tunnels, and then we can't think laterally about where the future's going.
You've had a decorated career up until this point where you've done many roles. Could you just summarise the main things that you're working on at the moment and what your main priorities are in 2026?
Thank you. Yes, thank you for having me here today. It's an exciting time, I think, to be working in healthcare, and particularly the intersection of digital health technology and healthcare, which is what I'm very lucky to be able to do every day. So part of my role at the moment is working with the Australian Digital Health Agency. So I'm their Chief Clinical Advisor for Medicine. So that basically means helping advise government on all the digital health kind of infrastructure implementation that we need to make sure that the whole country gets to capitalise on the potential of technology. So I do that part-time, and then I also still continue to practice as a GP. And I think it's kind of cool that one day you get to kind of inform the systems that you use, and then the next day you get to use them in real life, with your patients. And then I also spend some time sitting on some boards and committees, and we also have the Medical Angels Network. We invest in some startups, and I have Creative Careers in Medicine, the network of clinicians exploring what a career in healthcare looks like now and into the future. So it's a nice portfolio mix of things that I get to do.
Yes. And you've had a lot of steps along the way to get towards this diverse active portfolio. What would you say is the main lessons that you've learned along this path that you now implement or teach to other people?
So I think for me, the key has been saying yes. When people ask you if you're interested in doing something new or different, I don't think of all the reasons why I can't do it. I just think of all the reasons why it would be cool to do. And I always feel like you regret the things that you don't try. And so you could try something, realise it doesn't work for you, and that's okay, go and do something different. But I've even kind of pushed myself to say yes to things that I don't feel like I have the necessary skills and experience, but I know that I have the right attitude and that I'll get the skills and experience. And so I think the having said yes part is probably what's landed me where I am in my career. I didn't plan all of this. It's literally just people talking to me, being in the right rooms, getting exposed to the right opportunities, and then being enthusiastic about being involved. And then one thing kind of leads to another. So I think my advice to people is that, just lean in and say yes and try new things.
Yeah, and leading on to now, we're currently in Australian Healthcare Week 2026 in Sydney. It's a really diverse interprofessional setting where a lot of people from around Australia come together. What do you see as the benefit of big events like this, and how does that translate to better care for Australians?
Look, I think having these events is really important currently, because we've got, as I said earlier, this intersection where healthcare is meeting technology, and there's a whole group of stakeholders that need to be at that conversation, for everyone from governments that are setting policy, to regulators and making sure it's safe, to technology folk who are actually building the tech that we're going to use, clinicians who are going to use it, patients who are going to help inform. You need all of those people to be able to come together in one forum. And the problem with healthcare is traditionally we've all stuck to our own little group. So even in medicine, for a long time, I'm a GP, I would only ever go to GP conferences, and I'd only be around peers that were also GPs. And we didn't really get outside, sort of influence or exposure. And then I started wearing my digital hat. I was going to conferences of other specialty colleges. And I was like, wow, like at the weekend I was at the RCPA listening to pathologists. There's 1,500 pathologists in the room. I'm like, wow, that's cool. I've never really thought about it from a pathologist perspective. And then, I'm in the room with physicians, I'm in the room with surgeons. And then if you think about that, more macro, outside of healthcare, we need to have people who are building the tech. We need to have government in the room. We need to have people who are leading healthcare businesses and the startup founders. Yeah. And that's what these kinds of forums do, is they bring together all of those different people, a big melting pot, and you get to hear perspectives that you would never hear day to day in your everyday life. So I love that feeling of just that multidisciplinary, multi-stakeholder kind of environment, and I think that's where real change starts to happen.
Yeah, and we're just talking about that sort of diversity of opinions or diversity of representation of different stakeholder groups. How do you try and implement that in a lot of the initiatives that you lead or you take on?
So it's been really important for us, particularly the role that I have at the Digital Health Agency, to make sure that we have every diverse kind of stakeholder at the table. So we never implement or design or build anything without having all of the key people at the table, and we do a lot of consultation. I mean, sometimes I feel like it's actually painful having to do, the amount of consultation, because it does take us a lot longer to roll things out, compared to in the private sector where you're like, we're going to build something and, they will love it and we'll just see how it goes. Whereas in government, we're super careful to make sure, have we had the right consumers at the table? Have we had the right, sort of marginalised groups that may not normally, so we got to make sure that every single group we have considered and thought about, because decisions that we make as government can have unintended consequences, and we don't want to roll anything out that's going to disadvantage a particular group. So if we build, say, the My Health app, and we've built it in a way that people with disabilities can't access it, then we're actually making the whole problem worse. We're creating more of a digital divide, and health equity gets worse. So we're always driven by the quintuple aim, and we make sure that everything that we're building and designing is addressing all of those elements. And so for us, we have to have the right people at the table. So that's what I bring into the government role. But I think even when I'm working with startups or working in some of my private roles on boards and things, I'm always about connecting different parts of the industry, because I think we live too much in our own little tunnels, and then we can't think laterally about where the future's going.
And how do you see, just focusing from a digital health standpoint, how do you see the digital health landscape in Australia evolving over the next couple of years, and how quickly is it changing?
Yeah, look, I've been in this space for 15 years, and I have to say that it was really slow for a long time. I was hammering on about telehealth, and we need standards, and telehealth should be a great thing. COVID hit and everyone was like, oh my God, telehealth is amazing. But then after telehealth, I felt like we kind of stagnated for a bit, and then AI came along. And I think AI has really, forced us to push ahead. And part of the reason is because there is access direct to consumers. AI tools are available for consumers to use, and I think if they're using them in other parts of their life, they're like, well, we should be using them in healthcare, and we know that they are. 40 million people every day are going on ChatGPT and looking up health questions, right? So we've actually been pushed along as an industry by behaviour of our patients and our consumers, and so we almost don't have a choice. Like before that, no patient was pushing us to have an EMR implemented at a hospital. They weren't coming in saying, where's your EMR? That didn't make any difference to them. But patients are coming in saying, well, I'm using AI for healthcare at home, how come you're not using it? Or this is my output of my my Claude AI or my ChatGPT kind of discussion around my health. Can you look at that? And so as healthcare professionals, we've had to jump on that bandwagon. And also, I think it's the first time that implementation of a digital health tool, whether it's an AI scribe or agentic AI, has demonstrated benefits immediately. So your ROI is there from day one, where you see time saved, where you see, potentially resources saved or money saved from not having to have people do those jobs. Whereas I think a lot of traditional digital health implementations, whether it's EMRs or other things, there's been a very delayed ROI. So, you know, with EMRs, you roll them out and you try and convince government to put hundreds of millions of dollars into something and you go, it will save money, but in 10 years' time. Whereas I think with this, people are seeing the time savings, the money savings, etc., immediately. So it's like we're suddenly accelerating at a speed that is almost a little bit scary, I think, particularly for regulators and for us in healthcare who worry about harm and people, you know, potentially dying. Like, that's always our risk at the back of our head is, you know, are we doing something that's going to be unsafe? So I think we've had to move at speeds we're not used to moving as well.
And with regards to how quickly AI is moving, do you think that there's anything that the system is missing or needs to improve to ensure that safe governance and long-term performance tracking?
Well, I think governance is a big thing, right? And it's governance in a way that we've not done governance before, because here is almost like a live technology that is changing every day. And so how do you govern that? You know, on day one you say, okay, we know it's safe today, but is it safe tomorrow? Is it safe the day after? And I think there have been a lot of organisations, you know, whether it's big international groups like ISO or hospitals that have developed their own AI sort of policies, frameworks, guidelines, standards. Problem is those haven't been easily translatable into implementation of how you've got those standards, but how are we accrediting against them? How are we monitoring that? If there's an adverse event, where is it being notified? So particularly for software that doesn't come under TGA, so if it's not under the software as a medical device regulation, and it's an AI tool, if there is an incident, where are we talking to somebody to log that incident so that we can watch? It's not like a drug where we have very clear pathways of ensuring, you know, we've got adverse outcomes tracked and monitored. So I think the part that is missing for me is the governance, particularly ongoing. You want to see whether agentic AI is having further and further human drift, you know. How often are we comparing it to humans? How often are we sure that the outcomes that it's delivering are actually the outcomes that we started out with an intention? And I think the risk is also, the more we use AI, the more the data that is floating around is all AI generated, and we're starting to lose the human generated data. I mean, I imagine a world where human generated data is going to be at a premium. If you want to buy human data, it's like you have to pay, you know, 10 times the price, because there's not a lot of that now, and it's all, but if you want AI generated data, there's plenty of it. So, you know, I think we're moving into a very interesting period where we're going to have to figure how we're going to have this continuous monitoring and governance processes of technology that we've never really encountered before.
And I think something that scares a lot of people about AI is that human element, or losing the human element. What's the overall strategy, or how do you foresee us retaining and using AI to empower humans throughout this evolution process?
Yes, I mean, I think it's been talked about a lot. I mean, we've had conversations about, is AI going to replace the doctor? For decades we've been talking about this, and the answer is no. I still have a job, you still have a job, we all still have jobs, but will our jobs look different? Yes. You know, is it going to be important for us to understand how to use AI? And I think the most critical thing about understanding how to use AI is picking the right moment to use it. There's some things that you shouldn't be using AI for, and that might be, how do I break bad news to this patient? But there are other things where you're like, you know, give me all of the latest evidence for X, and I want the actual, you know, links to the original research articles, and I want to be able to look at those. And so I think it's about teaching clinicians how to use AI, when's the most appropriate time to use it, how to critically analyse, you know, the tool that you're using, and also its output. So when it gives you something, is it something that you should trust 100%? You know, where are some of the risks around hallucinations or confabulations? And so having them be critical about that is a part of medical education that I think needs to be inbuilt. And I think the doctors that know how to use that, or healthcare professionals that know how to use AI, will definitely be a step ahead of the ones that are still struggling a little bit with it. So I think it's more about our roles changing rather than being replaced. And I also think we want to build more tools that work seamlessly in the background, so we can continue to focus on the human interaction and just let that stuff happen in the background. That's where I see, you know, the human element remaining, or how we can make sure that AI is used to augment what we do rather than replace what we do.
Yeah, because I think the education part of that is also quite important, that a lot of the healthcare professionals want to know and know that they need to learn about this. For people who are already working in healthcare, what are some ways that they can learn more about how to use AI effectively or how to balance it with different parts of their job?
Yeah, look, it's a great question, because I think some people feel like they need to go and do a whole university degree and learn actually to code or to build AI tools, but you don't need that level of knowledge. I think there's plenty of courses out there now that kind of address around the healthcare implementation and the governance side of things. We at the agency have worked very hard on building sort of training materials to help educators put digital health literacy into undergraduate degrees. So trying to make sure that all healthcare professionals have some level of digital health training, and some of that may include AI. So that is for the future, but I think people working in it now, there's lots of courses around. I mean, you can go to AIDH, the Australian Institute of Digital Health, the Digital Health CRC. There's a lot of groups that have put out training, and all your usual universities. I'm sure your university has something as well. But I do think that people need to focus on the governance, the implementation, the critical analysis, rather than the understanding, how to actually, build algorithms or anything, unless they want to do that. So then it's less daunting. But I would say, definitely upskill yourself if you're going to be using these tools. Anyone that's using an AI scribe should have done some training and education around governance.
So speaking about Australian healthcare professionals, in addition to your other roles, you've also set up this great initiative called Creative Careers in Medicine, which focuses on giving clinicians and also students now more opportunities. How can people involved in healthcare or learning about healthcare get involved?
Yeah, so this community that I started, I really started because I felt like there was something missing. When I first started Creative Careers in Medicine, it was after I had come out of a role at Telstra Health, and I was working in technology, and I wanted to find other clinicians who were also working in technology. And then I realised that community didn't exist. So my view is, if something doesn't exist, build it, which is literally what we did. We built it. We've now got 25,000 people in that group, and they come from all different backgrounds. They've all started with a medical degree but have gone into various other sort of non-traditional roles. Some of them still sitting on the sidelines going, maybe I want to do this. Others are deep into an alternative sort of career. And others, are seeing that the future is going to look different. So they, particularly students, and saying, how can I make sure that I upskill and make sure that I have the relevant expertise to have a long, have longevity in a medical career, because in the future people are going to need digital health knowledge and training. They're probably going to need leadership skills. They're going to need to understand how to work in a world that is changing really rapidly. And so for us, a lot of what we're doing is providing education. So we have conferences. So we've got our big conference in September in the Gold Coast, on the 4th and 5th, where we bring everyone together. We expose them all different types of careers, whether it's management consulting, research, medical education, technology, AI, and really get them ready for the future, and also give them that diversity of options, which isn't just, do you want to be a physician, a surgeon, or a GP, which is pretty much all I got told when I went through med school. And so I love giving people, that knowledge that you can pretty much do anything with a medical degree. And so that's really what the community is about. And then we also have jobs that get advertised, and, we create webinars and things, and we've got a podcast series as well where we've interviewed many different doctors, both here and internationally. We've got some in the UK, the US and New Zealand, talking about their interesting careers in those countries. And the important thing is, this is not a problem unique to Australia. Doctors all over the world are facing this, whether it's burnout that's pushing them to look at different things, or whether it's the world is changing and I need to adapt.
And I think it's a really inspiring message and is really helpful for a lot of people in healthcare as the field is changing. Final question is that what does the culture or the mindsets of a lot of the people in healthcare need to adapt to fully harness the change that's happening with the digital health revolution?
Yeah, I think it's about being open-minded. You know, the way that we've been doing things for a long time has worked to an extent up till now. But we are seeing increased demand for healthcare services, decreased supply of workforce, tightening resources around, you know, having budgets that are going to support lots of things. So we have to work smarter.
Yes.
And the only way we can work smarter is to utilise some of the great technology that's available. So I don't see it as something that's optional. I see it as something that's, you know, necessary for us to not fall off this cliff where we're like, we can't actually provide services to keep our patients safe. And so my advice to people is that it's better to jump on the train, be with all the other people that are helping design and giving your expertise so that it's a system that you've co-built rather than one that is built around you and then you're asked to like be part of it, because that then means that it's not been built with your needs in mind. So I definitely encourage people to get involved, you know, as much as they can, and it's much more fun when you're involved, I can tell you. And there's a great community, you know, you realise that we're all wanting the same thing.
Okay, thank you very much for your time.
Thank you so much for having me.